Hi, this is Dr. Bernard Beldholm, and in this video I'm going to talk about the recovery from a dual-vector abdominoplasty. I'm really excited about the dual vector. I see a lot of post-weight loss patients that have a lot of loose skin. One of the really great benefits with the dual vector abdominoplasty is the amount of skin that I can remove. So what is it? Well, it's a abdominoplasty that cuts the skin at the top as well as the midsection and the bottom section. It's a combination of a Fleur-de-Lis and either a lower chest lipectomy or upper abdominal lipectomy. You can call it either way. But we're removing that loose skin at the top as well as midsection and the bottom section. And that's a big operation, but the big benefit is that we are getting rid of a lot of loose skin. And a lot of post-weight loss patients, I find that I do a lot of a range of different operations, and we do the normal extended abdominoplasty, we do the Fleur-de-Lis, and I do the bigger ones, circumferential hybrid and all those sort of things. But the most common thing is the anterior side. A lot of the time we can do a Fleur-de-Lis, which is the vertical cut and down the bottom, and get a really excellent result. But a lot of patients will have a little bit of that excess at the top of your abdomen or lower chest, whatever you want to call it. So that's the dual vector. It just gets rid of that top bit as well as the amount that you get from a Fleur-de-Lis operation. So the benefit is really big reduction of loose skin. The downside is that it's a significant operation, 4 or 5 hours. It's a long operation, as well as there's long cuts. So because there's a significant amount of cuts involved on incision lines, that means that it's going to be a significant amount of risk of breakdowns, wound complications and infections. So it is something that it does take a little bit of time to recover. The junction between those different incisions are the ones that do tend to cause a bit of trouble. So the one that is at the top, we put it all together like that, and then down the bottom we put it all together like a T-junction. So that are the areas that do tend to break down. If they break down, it tends to be 1 or 2 centimeters. Sometimes there's a bit of fluid underneath the wound. A lot of times we have to do wound dressings and wait for that to all settle down. So let's have a look at the actual operation, the sort of sequence that happens. The first day tends to be the worst. So the actual operation takes 4 or 5 hours, depending on if you're doing liposuction, how much loose skin, that side of things. You go to recovery ward. From the recovery ward, you go to the surgical ward. So the first day you'll have a IDC catheter in, you'll have a cannula in for pain relief. You'll have 2 drains down the side. You'll have what's called scuds or calf squeezers on. There will be a pico dressing, suction dressing, so you'll have that as well. So there'll be a lot of plastic tubes everywhere coming out, which makes it obviously quite uncomfortable that first day. Once we get through the first day and once you're up and walking, we can take the catheter out, which makes it a lot more comfortable. Depending on, a lot of patients get a bit of blood pressure issues the first day or two, so you're in hospital, you may not be able to get out of bed as easily those first few days. Usually once you get to the second day, the blood pressure issues do tend to settle, and we can start take out stuff and make it more mobile and more comfortable. With bigger operations, I tend to use blood thinners for 2 weeks after the operation. So you'll be injecting yourself with Clexane to prevent DVTs or clots in the legs, which is one of the can be a serious problem after an operation. So that's the kind of the first 2 days. That's the biggest sort of struggles. I'll see you every day in hospital when you're in. It may take 3 to 4 or even 5 days to get home after that. Now once you get home, You'll come in to see us in the practices or in the clinic, and we'll do wound reviews, review your wound and the light treatment and nurse review, make sure everything's going well, there's no seromas, etc. So we'll look after you quite well in those, especially that first 2 weeks, which is when most of those little issues do appear. Once you're over the first 2 weeks, generally you are walking around comfortable. You're definitely not completely pain-free, but you're certainly mobilizing comfortably. You're able to do your day-to-day stuff. Generally from 2 to 3 weeks, you're able to drive. You may find that you may need another a week after that, depending on how you're going. Usually if you're really fit and well and you exercise regularly, those first few days and those first 2 weeks are usually easier than if you're a bit more sedentary and have medical issues, etc. So being fit and well is really important for your recovery. So that's probably the one takeaway point. If you are planning to do something bigger like this, get fit. Muscle and cardio, really important, because that will really help you through the recovery. Now, compression garments are very similar to other abdominoplasties I do. So we do a wraparound compression garment that stays on for full time for 4 weeks, and then another 2 weeks after that we do half time. So I recommend during the day, but sometimes if it's really hot during the day, then we may swap it around. Once you're over that initial period, so 2 weeks driving, if you're working from home, you can usually do that once you're off the heavy duty pain relief. So that's the opioid based pain relief. If you are taking that, then obviously you shouldn't be working or driving or anything like that. So most of the patients are about a week after their main operation are able to get back to like doing work on the computer at home, etc. And then we gradually go from there, and you can start doing driving and then going back to low impact work at 2 weeks. And then if you are doing a lot of heavy lifting or moving around a lot or driving to different places a lot, then 4 weeks is probably more realistic after this type of operation. Usually you'll have access to me and a nurse in the office. You'll be able to call for help as well if you're feeling unwell. So that's all good as well. Wound care is done by my nurse and me. A lot of times if you do get a breakdown, then we'll do the wound care and we'll just keep seeing you until that is all sorted. As I said, the most common is the wound-related things and the breakdowns. If that happens, we tend to do wound dressings and then just wait for things to settle after that. So I hope you found this useful. Come and see me, do an online booking, set some questions aside, and see you in the next video.